It seems unimaginable, really, that surely someone would have noticed that either this thing wasn't on the tray when you're checking all your instruments at the end, or that you just see it.
Why is this even a thing? Because if it's a never event, then it should never be happening.
But sometimes it can be devastating. And I think the wrong labelling can be a real issue.
But of course, many people would think, well, if it's a never event, then inevitably there must be a claim that follows it. But that isn't necessarily the case.
It's like, well, this is kind of the bare minimum of the thing you're not supposed to do.
Hello, welcome to today's episode of Medical Negligence Matters. Today we're going to be talking about never events, and with me is my friend and colleague Corrina Mottram. Hi, Corrina.
Hi.
So our subject is never events, and I suppose we should start by trying to define that. I mean, because I think many people would say, well, somebody being harmed by their healthcare is something that should never happen. So what do we mean by a never event? And I think that people should understand that a never event is a term that has been devised by the NHS to describe a category of incidents. And those are things that are adverse outcomes from healthcare, which are preventable if proper safety protocols are followed. And what's the reason for defining them and separating them from other medical negligence cases?
I think the differences can be quite subtle in all sorts of ways, but I think the issue with never events is they are entirely preventable. It doesn't come down to clinical judgment. Did someone just interpret something in slightly the wrong way and therefore they've sent a patient down a particular pathway when an alternative pathway would have been the correct one? This is quite basic stuff.
And the purpose of recording them is so that there is some statistic and presumably some aim to prevent and to introduce systems or to refine systems to make sure that they truly do never happen.
Yes, absolutely.
So perhaps we should start with some examples of the sorts of things that constitute never events. What sort of things have you come across?
So we have things like wrong site surgery. So that the obvious example is, a procedure that's carried out on the left limb rather than the right limb, those sorts of things, or the wrong part of the body is injected or biopsied.
Or even sometimes, surprisingly, the wrong patient.
Well, absolutely.
And many people would be surprised to hear that does still occasionally happen. But, I mean, it's why obviously everybody is labelled when they're in hospital. But
and I think why nurses and, clinicians of all sorts seem quite fanatical about, can you just give me your name and date of birth at every step of the process? And it is, I'm sure, to make sure they've got the right patient in front of them.
The right individual, of course. And as you say, the wrong site surgery, so operating on the wrong side or the wrong part of the body. And I think anyone who's had an operation will know that generally these days the surgeon will mark the relevant side so that it's very clear which part of the body is to be operated on. But I guess we've also come across examples where things like the wrong implants have been used, haven't we? And either the wrong size or indeed the wrong side, like a left-sided knee replacement being put in a right knee, which can have very devastating consequences and a very poor outcome. Can we think of any other sort of examples of things that should never happen but do?
Well, there can be things being left inside people during procedures, whether that's swabs are a very common example. I say very common. There are small numbers that we're talking about across the country as a whole. But of those small numbers, a high proportion are things like swabs being left inside people.
And of course, those are things that are supposed to be counted into the patient and counted out again.
Yeah.
So there's protocols in place that ought to prevent these things, and yet they do still happen. And yes, I think I've seen quite surprising incidences of quite large bits of surgical kit being left behind inside patients. And I think from a layman's point of view, it's difficult sometimes to understand how a very significant piece of surgical equipment could be stitched up inside a patient.
It seems unimaginable, really, that surely someone would have noticed that either this thing wasn't on the tray when you're checking all your instruments at the end, or that you just see it inside the body before you start to repair the wound, repair the incision.
Yeah. Another sort of common category, I think, is medication errors, isn't it? This is something that certainly in the NHS sort of list of recognised never events, the sort of things that they're looking out for, things like medication errors, giving the wrong dose of things, or things being improperly labelled, so it's not sufficiently clear to a nurse or a doctor acting quickly, that if a package of a particular medication isn't properly labelled, it can mean the wrong substance being given.
No, that's right. We have all sorts of examples. There are a number of medications. The dose is identified with reference to the patient's weight, for example. And if someone's just done that simple calculation incorrectly, either because they're rushing or just because they've just made a mistake, because we're all human, we all make mistakes, and the wrong dose is then given, sometimes it's fine and the patient doesn't suffer any harm, but sometimes it can be devastating. And I think the wrong labelling can be a real issue. We have quite a number of inquiries from people who have been dispensed the wrong medication. Fortunately, somebody's noticed before they've actually taken it, or after they've taken, maybe one dose, and they haven't come to any harm, which is obviously what you want. But
it's difficult, isn't it? Because somebody who picks up a packet of pills from a pharmacist would normally be trusting in that pharmacist to have put the right thing into the packet, and surprisingly, not everybody is I guess well informed enough to know that they also need to check for themselves. Another aspect that I think we've seen a few times is not only the wrong medication being given, but the wrong route. Yes. And I think this has historically been significant in cancer cases where there are certain medications that ought to be given by a particular route, and if they're given in the wrong way, the response can be sort of catastrophic.
Yes.
And I'm just wondering how never events in clinical negligence are different. I mean, do you think that it has a different impact on a patient where what they've suffered is classified as a never event?
I think that's a really interesting question, because I think any patient who has suffered clinical negligence or suspects they've suffered clinical negligence, there is a sense of your trust being betrayed, or at least a sense of anxiety about the fact that you've gone to see someone for the professional help and you've been let down by that process. And I think when it's a never event, I suspect that feeling is even more acute for those patients, because it's like, well, this is kind of the bare minimum of the thing you're not supposed to do, the thing that shouldn't be going wrong. And if even that is going wrong, I think it can undermine people's trust and faith in the medical profession in a very damaging way, particularly if it's someone who needs ongoing treatment.
Yes. I mean, it might be worth thinking a little bit about, at this point, about statistics, because, of course, some people might be listening and thinking, well, why is this even a thing? Because if it's a never event, then it should never be happening. But, of course, the reality is that these things do happen. And looking at the recent statistics, do we have any numbers as to the idea of how often these events do occur? Yeah,
well, NHS England helpfully do publish statistics every year on this, and it's been running at about 400 incidents, slightly more, slightly less. Over the last few years, it's been fairly consistent. Slightly less in the last year we've got complete stats for, so 23 into 24, although the current year, 24 into 25, it looks like we're right up there in terms of the numbers so far.
So I suppose it's in the in terms of the number of clinical interactions that take place every year in the country, it's a very small number, but it's still more than one a day.
Yes.
And when we're looking at things that should never happen, then people might think, well, actually,
that's quite
one
a lot.
Day is quite a lot. And I just wonder whether what is the purpose of even looking at never events? Well, I suppose, as I said at the outset, the reason for introducing the term was this idea that it enabled some focus on the causes of these incidents and hopefully to highlight some way of preventing them. And do you think that never events are dealt with differently within trusts than other adverse outcomes?
I don't know is the honest answer, in that I think that there's not a lot of transparency from a number of organisations about precisely what they do in response to different events. I think that there are certainly reports of some trusts not necessarily being terribly proactive about ensuring that when a never event happens, systems are examined and changed where necessary to prevent that happening again. It's as if telling people that this has happened is enough.
Yes, I think that's right, isn't it? Because trusts these days will have a responsibility to carry out investigations in cases where there has been a serious untoward incident in healthcare. And I think that the NHS, their own data rather suggests that one of the problems with never events is that the reporting of it doesn't necessarily result in any positive action to prevent recurrence. And I don't know that, I suspect that's probably multifactorial, isn't it? Because, just issuing an alert about something isn't the same as instigating some steps or procedure to ensure a non-repetition. But also possibly because the responsibility for dealing with never events or dealing with the outfall from them is sometimes perhaps delegated rather too much down the chain. So there aren't clinicians sufficient seniority with authority to make changes who are dealing with them. And from a patient's point of view, what can be done? Obviously the complaints process is always something that patients can take advantage of with a view to trying to get an explanation and the trust's own investigations. Again,
I think all of these can be useful tools, if you like. A complaint, if the trust decide off their own back to undertake a serious incident investigation, all of those can be quite useful avenues to explore. I think one thing that we bear in mind, certainly, and we do try to warn our clients about if they come to us before the outcome of a complaint or a complaint response or the outcome of an investigation, is that, sadly, from our perspective, they're not always as transparent as we might hope they would be. And they may accept that there were some failings, but dispute that it's made any difference to the patient when we're looking at a client who we think it seems fairly obvious is in a less good position than they should have been in if the never event hadn't happened. And I think the issue is often for the client that they don't feel like they're getting proper answers or a complete answer from the trust. Having said that, it is still useful information for us, and I would always encourage my clients, if the trust is saying, look, we're going to investigate, that they should be pleased about that, because we will maybe get further information. They may want to participate if they're offered an interview. They may not want to do that, and I tend to think that that's something for them to decide.
Actually, it's raised an important point in my mind, actually, from what you've been saying, of course, is how a never event might affect bringing a civil claim for clinical negligence. But of course, many people would think, well, if it's a never event, then inevitably there must be a claim that follows it. But that isn't necessarily the case, because I think, as you've just touched on then, that although if a never event has happened, it rather suggests that it should have been avoidable with proper safety protocols. But of course, in the civil claim, not only have you got to prove that there was some sort of fault or some breach of duty, but you've also got to prove that that is what caused your injury, rather than being part of your underlying health process. And so in that respect, it's, it doesn't necessarily follow that a never event results in a successful claim.
No, that's right. And I think that's most often the position with medication errors. So if the wrong dose or the wrong medication is prescribed and it's either spotted before the patient takes anything, or they've only taken a dose or two and it's something that doesn't have a significant effect at that point, well, then it may well be a never event, but there is no claim, because fortunately, they're okay and they're fine. It hasn't caused them any additional harm over and above their underlying condition.
Yes, and so I'm just saying, how do we go about proving that? Well, I suppose that's a matter for expert evidence,
Yeah.
isn't it? And we would need, even in cases where it seems that liability must be clear, we do have to go through that same process of getting the evidence, not necessarily to prove the breach of duty, but to prove that there was a direct link and correlation between that and the harm that's been suffered.
Yeah, absolutely.
And in terms of prevention, I mean, I think this is a matter really for the health service rather than the individual patients. But I think patients are always very keen to be reassured that if a never event has happened to them, that something is going to be done that will prevent it happening again. And do you think that the recording of never events has had any impact on that?
It's very difficult to know. I think given that the numbers seem to be relatively static year on year, certainly in the last few years, that would suggest that maybe there isn't, a significant impact of the recording. But certainly it's better to have it recorded than not. Certainly nothing's going to change if people are ignoring them. But I think we need to be persistent.
I think that's right. There's lots of talk, and certainly in recent years, isn't there, about trying to bring in the ideas from, for example, aviation safety, and this idea of black box thinking. And the airline industry have been very good at dealing with, I suppose, what they would call their sort of never events and things that happen that are safety issues. And I think that they've managed to develop a culture which enables much more open examination of these kinds of things. And I think that there has been an attempt to bring that kind of thinking into the clinical process.
I think that's true. And I think developments like the duty of candour, the obligation to be open and transparent with people when there have been issues with their treatment, I think that helps. I think there is still some wariness over how consistently that people comply with that duty. But I certainly think that it's something to be encouraged. And I think it can help the patient if that happens quickly and effectively. Because a lot of the people that come to see us feel bewildered about what's happened to them because they feel that something has gone wrong, but no one's expressly accepted that or said that to them.
Yes, I think that clear acknowledgement and explanation at an early stage makes it very much easier for patients. And I think that there is an attempt within the recording or the processes and the protocols for recording never events to try and remove that the element of blame, which I hope perhaps would make it easier for people to be open about what's actually happened without thinking that the world's going to fall on their head as a consequence of that. But as you said, the fact that the numbers seem fairly consistent is not entirely encouraging. Once a medical negligence claim that involves a never event, let's say in terms of process, I suppose is very similar to many other types of claims, is that the investigation and the fact-finding process is the same.
You would hope for a quicker admission of liability in a never event claim, just because it is a never event. And if you can prove that that is what has happened, you would think there's no basis for a denial, but that still leaves us with the obstacle we've already discussed of establishing the harm that has happened as a result of that, and the injury that would have been avoided but for that never event happening. And that can be a really hotly contested issue. And so the process quite often follows exactly in line with all sorts of other claims that we deal with.
I think that's right, and perhaps just underlined more than any other the importance of that, the duty of candour, the admissions by the trust of things that have happened, and I think also importantly, for most clients to have some sort of reassurance from the trust that something is being done that will prevent it happening again, so that there's something positive that can come out of a very negative experience. And I think that if the chief executive of the trust or some representative of the trust is able to give some assurance to the patient that there's an acknowledgement of the seriousness of what's happened, and the fact that real concrete things are going to be put in place to prevent, not just, steps will be taken, because, there's a form of words that we can get a bit tired of hearing, but that actually if there are practical and detailed things that the trust is able to share with the patient to give some reassurance that the risks of a repetition are significantly diminished, that's got to help, hasn't it? I
think absolutely. I think so many people, as you've alluded to earlier, they really want to make sure that no one else has to go through what they've been through. And that's can be one of the really significant driving factors of them coming to see us, because they feel that in the interactions they've already had about whatever it is that's gone wrong, they don't feel that there's a proper recognition of what's happened and the seriousness of it, and an effort to ensure it doesn't happen again. And that's often why a lot of people end up contacting a solicitor, because they feel that that's perhaps the only way of achieving that aim.
Thanks, Corrina. That's really helpful.
Thank you.